Wash my hands. Introduce myself. My name is Casey. I'll be a nurse practitioner student doing your exam today. So across the room assessment, I'm going to look at the dress and grooming. She's appropriately dressed, appropriately groomed. Skin color is normal, no apparent distress noted. Go ahead and start out with the vital signs. We're going to count respirations. Respirations 14 to 16 even and unlabored. I'm going to go ahead and do the pulse. Also 70 with a normal rate. Pump the blood pressure cuff up to 160 and release slowly. One 112/64, which is a normal blood pressure. Go ahead and get the temperature. (98.2), which is a normal temperature. And how tall are you?
5'2".
All right, and how much do you weigh?
130.
All right, that's approximately 24 BMI, which is normal. I'm going to go ahead and move on to my head to toe assessment. I'm going to look at the scalp, go ahead and palpate it while I'm doing that. Hair distribution is normal, no lesions present. Symmetrical, no tenderness, right?
Yep.
Face is symmetrical. Go ahead and bite down. Trigeminal nerve 5 is intact. No tenderness there while I'm pressing. Okay, go ahead and raise your eyebrows. Pull out your cheeks. Smile for me. Okay, everything looks normal there. I'm going to go ahead and look at the eyes. Pupils are approximately a 4 and normal. Go ahead and do the Snellen chart. Hold that arm lightly. Cover one eye for me. Read the lowest on it you can.
LTFPH.
All right, cover the other eye. Read it again.
HPFTL.
Good. All right. 20/20 in both eyes. All right. Go ahead and look at my nose, and you're going to follow my pen without moving your head. Cardinal movements are all normal. Go ahead and still look at my nose here. Pupils are equal and reactive. Accommodation present on both sides of normal. Structures of the eye appear normal. The iris, conjunctiva, pupil, eyelids all appear normal. Go ahead and close your eyes for me. Tell me if this is sharp or dull.
Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay. Does this feel the same on both sides?
Yes.
Okay, no difference there. I'm going to test sensation here. Is that all normal?
Mm-hmm.
Okay. All right. Eyes are normal. Go ahead and do the ophthalmoscopic exam. Red reflex present, arteries and veins, retina appear normal. Bilaterally, all structures appear normal. All right, go ahead and inspect the nose. So the nose appears patent on both sides, nostrils normal. Nose ring present on the right side. Go ahead and look in your nose. Septum is non-deviated. Turbinate's slightly reddened on the left side. Right side up here. Normal. Have a look at the mouth. Lips appear normal. Oral mucosa is pink and moist. Dentition is good, but not in the mouth. Teeth fit together well. We're going to stick out your tongue. Tongue is midline, no fasciculation is present. Go ahead and say ah. Uvula is midline. Tonsils present, non-swollen. No erythema, no exudate. Gag. Gag present. All right. We're going to go ahead and examine the external ears. Ears are normal externally. Small, dark scar on the right earlobe. The Wren and Weber test. Okay, so I'm going to put this tuning fork on your head and tell me if you can hear in one ear better or the other. Or it's equal. Okay, and I want you to tell me when you can stop hearing the ringing. I'm going to put it behind your ear first, and then I'll pull it out from your ear.
Okay. Okay.
Same thing on this ear.
Okay. Okay.
All right. Conduction appears normal. All right. I'm going to go ahead and get you to move your head from side to side, in front to back. Neck range of motion appears grossly normal. I'm going to go ahead and feel your neck here. Your pre-auricular, post-auricular, submental, submandibular, tonsillar, anterior cervical, supraclavicular nodes. No swelling or tenderness noted. No tenderness, right?
Yep.
Occipital, posterior cervical, subclavicular, or scapular, subscapular, central, thoracic, and axillary lymph nodes. No swelling present, no tenderness, right? Okay. I'm going to go ahead and stand to your side here and feel your thyroid gland. Thyroid gland feels normal, symmetrical, no nodules present. Go ahead and swallow for me. normal movement with swallowing. You swallow, okay, problem swallowing, right? Okay. All right, I'm gonna go ahead and feel your shoulders. Go ahead and shrug against me. Good strength on both sides, equal. Let me know if there's any tender spots. All right, raise your arms up in front, to the side, and over your head. All right, full range of motion, arms up and down, hands. Full range of motion present in all limbs. Go ahead and tell me whether this is sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Dull. Dull.
Does it feel the same on both sides?
Yeah.
Okay. All right. And go ahead and hold your arms out like this. Turn them over. Hold them out for 5 seconds. Move drift present. Squeeze my hands. Your strength is equal. All right. No lesions on the skin noted on the thorax or arms. Tattoos present. Otherwise, skin appears normal. All right. I'm going to go ahead and move on to chest. Go ahead and take a deep breath for me. Symmetrical expansion. Go ahead and feel the carotids. One at a time. 2 plus. 2 plus bilaterally. And thrills present. Also take the carotid arteries. Pulse is audible. No grooves present. Go ahead and listen to your heart sounds. The aortic first. Pulmonic. Erb's point. Tricuspid. And mitral. Heart sounds are normal, S1, S2. We'll go ahead and palpate for the PMI. PMI barely palpable, present at the 5th intercostal space on the midclavicular on left side. Go ahead and listen to your lung sounds as well. 2 deep breaths at each spot. That sounds clear and equal bilaterally. Go ahead and palpate the back of the thorax. Count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
All right. All here is normal. Palpation is normal. No increased tactile firmness. When talking, I'm going to go ahead and actually percuss. Equal throughout, no dullness present. And listen to your lung sounds in the back. 2 breaths at each spot. All right, and say E,
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 E, E, E, E.
All right. Sounds normal throughout. All right. So go ahead and see for tender back here. Just let me know if this hurts. Negative CVA tenderness. Go ahead and have you lay down. Expose the stomach. Inspect first. No scars present. No obvious hernias, no stretch marks. Contour is normal. And listen to the stomach in all 4 quadrants, starting in the right lower quadrant. Bowel sounds are normal and active throughout. So they'll listen to the abdominal aorta. No bruise present. Listen to the iliac, renal, and femoral arteries as well. No bruise present. I'm going to percuss the abdomen, first in all 4 quadrants. Sound is normal throughout. Going to increase tympany. Going to percuss for the liver edge. Dullness ends at about the 11th intercostal space. Percuss for the spleen. Spleen is non-palpable. Deep breath in. Out. Negative Murphy sign. All right, I'm going to percuss the urinary bladder. Sound is normal. I'm going to go ahead and palpate your abdomen. Let me know if there's any tenderness. No masses noted. No tenderness. I don't know if the first one I'll let out. Okay, no rebound tenderness. No negative Rossing sign. Go ahead and resist. Come on. There you go. All right, good. Negative psoas sign. So go ahead and lay on your left side. I'm going to move your leg here. And externally rotate. Any soreness there? Okay. Negative obturator sign. Remain laying on your back. All right, good. All right. I'm going to go ahead and palpate the hips. They appear normal. No swelling or edema. Pelvic bones intact, equal, symmetrical. No soreness on the legs noted. Okay, go ahead and lift this leg up as hard as you can. Out, back in, down, and out to the side. Range of motion is normal. Same thing with this one. Out to the side. Good. All right. Everything appears normal. You go ahead and scoot down this side of the line. Good. Knees are normal. No swelling, edema. Everything feels normal. Go ahead and bend your knee up and back for me. Good. Normal range of motion on both sides. Go ahead and lift your feet up towards you, down. Good. Same thing with this one. All right. Good. Palpate the ankles. Put your socks down. Off, actually. Dorsalis pedis pulses 2+ bilaterally. Same with the posterior tibial. And go to the femoral pulses. Radial. And brachial. All pulses are 2+ bilaterally regular rhythm. When you tell me, is it a sharp or dull sensation?
Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull.
Does it feel the same on both sides?
Yes.
All right. And close your eyes. I'm going to give you an item. Can you tell me what this is?
Knee hammer thing.
All right, reflex hammer. Yeah, that's correct. All right. Go ahead and test your reflexes. Minimal movement. One plus. Same there. You gotta sit back up for me. Good. All right, just relax this arm. 1 plus. 1 plus. All right. Relax your arm. Relax. All reflexes slightly decreased. And go back and look in the ears. External ears are normal. External auditory canals appear normal. Light reflex present at 4 o'clock. The right side, tympanic membrane is normal and clear. External auditory canal normal. Light reflex present at 7 o'clock. Tympanic membrane is clear, non-bulging. Right. I'll go ahead and get you to stand up for me. Close your eyes. Just stand. Balance appears normal. All right, go ahead and walk heel to toe out there and back. All right, good. And back and walk back normally. Gait appears grossly normal. All right, you can go ahead and seat back down. Actually, lay back down. All right, gonna bend your leg up. Door maneuver, minimal movement on the left side. And same on the right. Push against my arms here. Strength 4 plus to 5 plus bilaterally on the legs. You can sit up. Raise your arms. Resist me pushing down. 5 plus strength in the upper extremities. Sam. Okay, so just look at my nose, just cover one eye. And then you can see my finger.
Okay. Okay. Okay.
All right, same thing with this one.
Okay. Okay. Okay.
All right, peripheral vision is intact and normal. I'll exam. It is normal, slightly decreased. Reflexes, slightly red, left nasal turbinates. Measuring present on the right side. Exam is otherwise normal. Skin appears normal with no lesions. That is it. Thank you very much for letting me examine you. Have a good day. Now, wash my hands. And